Advanced clinical skills for semester 7 of medical school. Advanced clinical skills. Objectives. Develop technical skills and knowledge to perform various medical procedures, both basic and advanced, that are important in patient care. Main material A. Basic invasive techniques. 1. Infusion installation. Indications. Rehydration of patients with moderate to severe dehydration. Administration of drugs or nutrition through the intravenous line. Stages. Vein identification. Choose the most easily accessible peripheral vein, such as the dorsal vein of the hand or the antecubital vein. Preparation of equipment. Prepare sterile equipment, including cannula, plaster, infusion fluid, and tourniquet. Procedure. Apply a tourniquet to increase visibility of the vein. Disinfect the skin in the puncture area. Puncture the vein with the cannula. Make sure there is blood returning. Flashback. Then release the tourniquet. Fix the cannula using plaster to ensure stability. Possible complications. Phlebitis. Inflammation of the vein wall due to mechanical or chemical irritation. Fluid infiltration. Infusion fluid enters the surrounding tissue due to leakage. 2. NGT. Nasogastric tube installation. Indications. Providing nutrition to patients who cannot eat orally, e.g. coma patients. Gastric decompression, for example in intestinal obstruction. Stages. Select the size of the NGT according to the age and condition of the patient, e.g. 8 to 10 fr for children or 14 to 18 fr for adults. Lubricate the tip of the tube with lubricating gel to facilitate entry. Insert the tube slowly through the nose until it reaches the stomach. Verify by auscultation of air in the epigastrium or chest X-ray examination. Complications. Nasomucosal irritation. Due to friction of the tube with the nasal passages. Perforation. Small risk if installation is not careful. Wrong direction. The tube can enter the respiratory tract. 3. Urinary catheterization. Indications. Overcoming acute urinary retention. Monitoring urine output in critical patients. Stages. Choose a Foley catheter with a size according to the patient's needs. Perform aseptic procedures, including washing hands and sterilizing the genital area. Insert the catheter slowly until urine flows, then the catheter balloon is filled with sterile fluid for fixation. Complications. Urinary tract infection, UTI. The risk increases if asepsis is not maintained. Hematuria. Minor injuries to the urethra can cause minor bleeding. B. Emergency skills. 1. Cardiopulmonary resuscitation, CPR, BLS. Basic life support. Steps. Ensure the safety of the location for rescuers and patients. Check the patient's response, e.g. by shaking the patient's shoulders and talking. If the patient is unresponsive and not breathing, immediately perform chest compressions. Ratio: 30 compressions followed by 2 rescue breaths. Use AED, automated external defibrillator, if available, to deliver electric shock to patients with a reversible heart rhythm. 2. Endotracheal intubation. Purpose: ensure the airway remains open in patients in a coma or respiratory failure. Technique: use a laryngoscope to help see the vocal cords. Insert the endotracheal tube past the vocal cords. Then connect it to a ventilator or bag valve mask. Complications: injury to the larynx. Misplacement, e.g., entering the esophagus. C. Interpretation of vital signs. 1. Cardiac monitor, ECG. How to read: normal sinus rhythm, regular PQRST complex. Disorders: atrial fibrillation, AV block, ventricular tachycardia. Initial action: bradycardia, atropine if accompanied by symptoms. Tachycardia, adenosine for supraventricular tachycardia. 2. Blood pressure measurement. Use manual sphygmomanometer with auscultation method, listening to Kawatak sound. Interpretation: hypertension. Blood pressure is greater than or equal to 140/90ths of a millimeter of mercury. Hypotension. Blood pressure less than 90/60ths of a millimeter of mercury, indicating the need for fluids or vasopressors. 3. Oxygen saturation, SPO. Interpretation: normal. SPO is greater than or equal to 95%. Low. SPO less than 90% requires oxygen therapy or intubation if the cause is severe.